Intensive mental health treatment is changing. We're talking about partial hospitalization and intensive outpatient programs. What if the most effective place for this therapy wasn't a hospital, but your own home? The data is surprising. Major research shows virtual programs aren't just a substitute. They're often equally or even more effective than in-person care. This success stems from a fundamental shift in how treatment is delivered and experienced, far beyond simple convenience. Next, we'll show the science-backed benefits of virtual therapy, from breaking down barriers to unlocking new therapeutic power. First, virtual care demolishes distance. It provides access to quality programs for people in rural areas or places without specialists. It also integrates into life. No commute means treatment can coexist with work, school, or family responsibilities. This lower friction is significant. Starting treatment from a familiar place makes taking that first step much easier. So access is better and it's more convenient. But what happens inside the therapy session? Here, the unique advantages begin. The home environment itself becomes a therapeutic tool. Patients report feeling safer and more relaxed, which is vital for vulnerability. This sense of safety fosters greater openness. People are more willing to discuss deeply sensitive topics from a secure personal space. Virtual therapy also dismantles public stigma. With no waiting room and total discretion, people avoid treatment less from fear of judgment. Critically, skills are learned in the exact environment where they will be used. A structured PHP schedule at home builds real-world routines. This blend of comfort, privacy, and real-world application has a powerful effect, leading to a dramatic drop in missed appointments. Fewer missed sessions is great, but how does this better patient experience create measurable clinical superiority? The answer is in the technology. Consider someone with agoraphobia or mobility issues. For them, virtual care is often the only practical path to intensive treatment. It also supports family therapy. Relatives can join sessions from work or another city, making their involvement far more consistent. We've seen how it works for different people in different situations. Now let's look at what the technology itself brings to care. Virtual platforms grant access to a national network of specialists. You can find a clinician with the exact skills you need. The speed of care is also transformed. Top programs offer mental health assessments within 24 hours, getting people help immediately. Treatment is augmented by integrated digital tools like 24/7 messaging, symptom trackers, and AI that helps personalize the process. This is not replicating in-person therapy online. It's a different, data-driven, and highly responsive model of mental health care. So, how does all this lead to better outcomes? The combination of a safe environment and potent digital tools drives superior treatment adherence. The data is clear. By removing barriers like travel and stigma, telehealth significantly boosts adherence and program completion rates. This is supported by studies showing virtual appointments have significantly lower no-show rates than in-person visits. Consistency is key. When you combine the psychological safety of being at home with the ease of access, you create perfect conditions for committed engagement. This consistent engagement is what leads to the most important outcome. Let's return to the powerful claim from the beginning. The reason virtual programs can outperform in-person care in preventing hospitalizations is that higher adherence means a more consistent therapeutic dose. This is why research consistently finds virtual care to be as effective and sometimes superior. It's about access, experience, and adherence. The case for virtual PHP and IOP rests on 3 pillars. First, unmatched access and convenience that removes practical barriers to starting care. Second, a fundamentally improved patient experience that boosts comfort, honesty, and allows skills practice in a real-world environment. And finally, superior clinical outcomes, which are driven by greatly improved adherence to treatment and supportive technology. Virtual intensive therapy is no longer just an alternative. For many, it's a more effective, accessible, and humane way to get life-changing care. If you or a loved one are struggling, know that powerful, effective help is more accessible than ever. Consider virtual PHP and IOP options. For clinicians and administrators, the evidence compels us to integrate and expand these vital services. This is the future of high-acuity care.